In this video, I will talk about 7 causes of back pain in kids. Back pain is a well-known source of discomfort in adults, but it is also being diagnosed more frequently in kids. Most parents don't expect their healthy kids to complain about back pain. However, back pain has been found to occur in between 14% and 24% of kids. Some reasons back pain may be common in kids include higher body weights of kids and higher rates of obesity, higher intensity and sports activities, and the increasing weight of backpacks worn by students at school. 1. Warning signs to know. Every parent whose child is complaining of back pain worries that a more serious problem may be occurring. While there are certainly serious causes of back pain, most kids with back pain have symptoms that result from muscle or ligament injury, without any structural abnormality. Some of the back pain warning signs to look out for more serious problems include night pain, constant symptoms of pain, symptoms of generalized illness, symptoms persisting beyond several weeks, symptoms in very young kids, leg pain, numbness, or weakness. These warning signs don't necessarily mean there is a more serious problem, however, they are a good screening test to determine if more evaluation should be pursued. For example, muscular back pain can persist for months, however, if the symptoms have been going on for several weeks, it's best to ensure the diagnosis is clear. 2. Muscular back pain. As stated, muscular back pain is by far the most common cause of back pain in kids. Injuries include muscle strains and ligament strains, overuse injuries, problems with posture, and poor conditioning of the muscles of the back. Most often imaging, including X-rays and MRIs, are not helpful at making this diagnosis, and these tests are generally not needed unless there are the warning signs. As with any test, there are downsides to excessive testing, so you should discuss with your doctor the value of obtaining any specific imaging study. Most often muscular back pain will respond to rest and modifications in activities. Many treatments may provide transient relief. These treatments might include physical therapy, chiropractic treatment, stretching programs, or massage treatment. 3. Stress fractures. Stress fractures can occur in the spine. Over time, signs of the stress fracture may show up. The most common type of spinal stress fracture is called a spondylolysis, an injury to the bone in the back of the spinal column. This injury occurs most of the people who do sports involving repetitive hyperextension of the spine, such as gymnasts and divers. If the stress fracture occurs on both sides of the spinal column, this can cause instability of the spinal column, or a condition called spondylolisthesis. Stress fractures often make kids and parents nervous, because these injuries typically don't heal, and they can cause symptoms into kids and young adulthood. However, most kids diagnosed with spondylolysis are treated non-surgical and do better with less invasive treatments. Surgery is typically reserved for those who have persistent pain even after many months of non-surgical treatment, or those patients with severe slips leading to loss of spinal alignment. 4. Disc problems. Disc herniations are much less common in kids than adults, but they can occur, and they can cause serious symptoms. When a disc herniation of the spine occurs, the soft cushion between two vertebrae is ruptured. Symptoms of a disc herniation can include leg pain, numbness, and tingling in the legs, weakness of the lower extremities, and difficulty bending or straightening the spine. MRI tests can be helpful to diagnose a disc herniation, as X-rays will typically be normal. In kids, the normal disc material is elastic, and it has a much better ability to withstand unusual forces on the spine. As with age, the disc loses its elasticity and can become prone to rupture. 5. Infection. Infections of the spinal bone or discs can be a challenging diagnosis to make. Often occurring in young toddlers, spinal infections may cause low-grade fevers, and generalized back pain. The diagnosis of spinal infection is often made because of abnormal laboratory studies showing signs of infection or inflammation. Treatment of infection usually can be accomplished with antibiotics, although occasionally surgery can be considered. Surgery is generally only considered if the infection has caused damage to the spinal structure or if the infection cannot be adequately controlled with the use of antibiotics. 6. Alignment abnormalities. Problems with the alignment of the spine can cause a noticeable deformity and may be associated with the occurrence of back pain. The two most common spinal deformities in kids are scoliosis and Scheuermann's kyphosis. Scoliosis is a deformity that causes an S-shaped curve to the spine when seen from the back. Scheuermann's kyphosis causes a sharp bend in the spine when seen from the side. These two conditions are very different, but the treatment principles are similar. In less severe deformities, observation is the most appropriate treatment. 7. Tumor. Several different bone tumors can occur in the spinal column. Sometimes these causes significant pain, other times they can be found without causing symptoms. While spinal tumors are a very unusual cause of back pain in kids, they should be considered as a possible, unusual, diagnosis. Some of the warning signs mentioned previously can be associated with tumors, specifically the complaint of night pain, or the complaint of generalized illness or weight loss. Back pain in association with these symptoms may raise the concern for possible tumors, and imaging tests can help to determine if that is a possible diagnosis. Treatment of spinal tumors is variable depending on the specific type of tumor. If you enjoyed this video, then you may like to check out our free guide, The Complete Back Pain Relief Program. You can download it for free from the link in the description below. If you want to make a video like this, then check the second link in the description below. You will also get a 7 days free trial for this software. Thanks for watching, subscribe and share this video with your friends and family who have a back pain problem and get a benefit from this video.